Pregnant patients with anemia are 3 times more likely to require a blood transfusion at the time of delivery. The condition contributes to about 20% of severe maternal morbidity in underserved groups. At Natividad Medical Center in Salinas, California, transfusion rates began to increase rapidly in 2021. The problem was particularly evident in the Latino and Native indigenous communities from Mexico served by the hospital.
Almost 20% of the women that presented to labor and delivery at the time of delivery actually had hemoglobins less than 11. And in our analysis of this and trying to figure out what to do, we realized ultimately that the care had to be done at the level of the clinic long before we got to the hospital. And so we looked at our resources, our relationships in the community, and where our patients were being taken care of.
Natividad's obstetrics leadership team taught medical staff at 8 community clinics about the negative effect of anemia, how to monitor patients' hemoglobin and iron stores, and best practices in treating iron deficiency, which often involves up to 8 rounds of iron infusions. They also opened a dedicated infusion center to provide access to IV iron therapy. As the program progressed, the team at Natividad found that requiring patients to return for multiple rounds of infusion created a significant barrier to care.
When we realized the costs involved in doing this, including the time, the infusion time and the resources needed, we approached our Medicaid HMO provider and really had a chance to describe the problem and then asked them if they would consider doing approving the one infusion product. And after consideration, they agreed.
Through education, collaboration, and breaking down barriers to care, Natividad decreased rates of anemia from 18.4 to 11.7% from 2021 to 2024.
I really do hope people go for getting iron infusions, or they actually do go in for their iron infusions, just because I felt it helped me a lot. It gave me so much energy. I felt so much better after my infusion. People actually noticed because I wasn't like yawning all the time or like very sleepy, very tired. My delivery went great. It was very fast and I didn't have any complications at all.